It's a dark picture being painted in our state. More people than ever dying as a result of opioid overdoses all over Massachusetts. Numbers out last week show nearly 1,400 confirmed deaths. It's almost a 50% increase from just 2 years earlier. And state officials believe the number is really much higher. Beacon Hill has a plan to tackle it, but will it work? Joining me with more on how is Massachusetts Public Health Commissioner, Dr. Monica Burrell. It's good to see you, Commissioner. Thanks for being here.
Good to see you. Thanks for having me.
My reading is Massachusetts used to be behind the national average a couple of years ago in terms of opioid overdoses and deaths. What happened? What caused us to move past the rest of the pack?
Well, you know, you're right. We do have an unprecedented number. As you're saying, you were just saying, in 2015 we saw 1,379 known deaths. That's more than 4 people a day dying in Massachusetts. We really are, though, seeing this kind of movement across the United States. This problem is across the United States, but it's particularly hitting us hard in New England.
Why?
And another piece of new data that we found when, for the first time in this report that you're referencing, we have now been able to match toxicology data. So we know that 57% of the deaths were associated with fentanyl. Now, it doesn't mean that fentanyl caused the death, but it means that fentanyl was associated with it, and fentanyl is much more powerful than any other opioid, so that may be leading to this increased death rate.
Do you have any reason to think 2016 is going to be any better than 2015, or is this growth rate going to continue?
It's a good question. It took us a long time to get to the point that we are now, and it will take us persistently working on this to get these numbers to go down. I'll tell you that the data we just released goes all the way through March 2016. And when you compare January, February, and March of this year to last year, it's about the same. It's a little too early to say, but we're going to have to be in this for a little while and continue to work before we see this really going the other direction.
You know, one of the positive things, if there's anything positive to be said about this nightmare, is there actually has been a laser-like bipartisan approach on this. Very little squabbling between Republicans and Democrats. Even though the Democrats weren't crazy about some of your boss, Charlie Baker's plans, they ultimately agreed on something. So Narcan, the reversing of overdose thing is more available, more limited first prescriptions of opioids in most but not all cases. I know you hope it turns things around. Do you have confidence that it will, or this is just the starting point in this battle, this plan that was passed and signed a couple of months ago?
So I'm really proud of the work that we did with Governor Baker's step law and the work with the legislature to partner together to come up with all of these things that you're talking about. And you know, this is going to take a while, but as we work along prevention, intervention, treatment, and recovery, making sure that people understand what the risks of opioids are, making sure there's enough Narcan in the community, that prescribers are educated on balancing pain management with opioid misuse, making sure there's enough treatment. We have to do more. We're not done yet, but this is a huge step in the right direction.
You know, speaking of prescribers, every single time I have a discussion on the show about opioids, I get email that says the following: I am suffering from horrible pain. My fear is that my doctor, because of this, is going to say, I don't want to deal with this at all. I'm going to shy away from what I mean, the doctor's not saying these words, but the patient fears going to shy away from what I really need because of this new oversight of doctors. Is that, I mean, I mentioned this to the governor a couple of months ago. He said it was a concern. How do you address that sort of cultural change thing?
You know, under the governor's leadership, we brought together all 4 medical schools, all 3 dental schools in a first-in-the-nation collaboration with the Mass Medical Society, Dental Society, the state, and those schools to say, let's have 10 competencies that we all agree every student needs to learn about. And those competencies are talking just about that, balancing the need for pain control with the potential for opiate misuse.
You know, yeah, one of the things, the word that Charlie Baker used a lot in these discussions is we need a disruptor. I'm not a professional in this, you are. From afar, I know we made important first collaborative steps. We haven't done a disruptor yet. We haven't done big thinking yet on this, have we? That's a fair criticism, isn't it?
I think a lot of what we're doing is disruptive. To limit the medications the way that we are, so first-time prescribing to 7 days, that's really being looked at nationally. And think about it, when you go to any community around Massachusetts now, people are talking about opiates. For the first time ever, people are talking about it as a medical disease.
So I heard, that's a quote, your quote when this thing came out, we must treat this like the illness it is without stigma. In a couple of minutes, the state rep Ferrante from Gloucester is going to be here. She's trying to get a statewide thing passed that emulates the national nationally celebrated effort by the Gloucester Police Chief and now the Arlington Police Chief, Campanella and Ryan, where you turn in your drugs, you turn in your equipment, and you're not prosecuted. Are you guys pushing for this to be implemented statewide? It seems to implement exactly what you're saying. It's an illness. We don't want a stigma. We don't want a criminal prosecution. Is that going to happen?
When you think about our State Without Stigma campaign, it's all about we have to get this from every angle, every sector. We all have to be involved. It can't just be medicine, can't just be the doctors.
So you supporting this thing?
Can't be just public health. It has to be law enforcement, educators, community members, families. We all have to come together in creative ways.
Are you supporting this thing?
For this to be treated as a medical disease and not a crime is the way to go.
One other quick topic, Zika. Every time anybody mentions the word, there seems to be almost panic. First case in the state, if I'm right, it was in January. There are now a grand total of 10 cases. We had, what, 25,000 flu cases last year? Are we not overly worried? I understand we should always take precautions about Zika. Are we not too worried about this in our state?
So the important thing about the 10 cases, so the CDC maps Massachusetts to have 10 cases. Remember, they were all travelers. So there has been no local transmission of Zika. Mosquito season is coming. We're keeping a close eye on this, and we'll do everything we can to make sure that we're balancing the message of making sure everyone's aware. Most importantly, if somebody is pregnant and they are traveling to a Zika-infected area, they should take precautions or consider
Should they go to the Olympics in Brazil in August?
I would tell pregnant women to avoid areas where there's Zika right now.
Dr. Brill, it's good to see you.
Always
good
good
luck
to see
with
you.
everything.
Thank you.
Thank you so much.